Evaluation of SNM in patients with neurogenic lower urinary tract dysfunction. Disclosures for StimWave, Promedon, Medtronic. The attendance is self-funded. For the approval of SNM, the FDA only allowed non-neurogenic patients, so-called idiopathic indications. However, the pioneer studies in humans, EA Tanagho and Richard Smith, included 22 neurogenic patients. Over the last 2 decades, in a highly selected patient group with neurogenic lower urinary tract dysfunction, we found indications and have performed those. We do know about the high prevalence, like in MS, with 75% of neurogenic lower urinary tract dysfunction, or even 30% of fecal incontinence. But the issue was the lack of MRI-compatible devices. This gap has been filled in recent years. 2 of the competitors have given the market implants which are full body MRI compatible, 1.5 and 3 Tesla, not only the IPG, non-rechargeable or rechargeable, but also the electrodes. The aim of the study was to look into the effectiveness and the safetyness of SNM in this patient group. We wanted to see the evidence of SNM in neurogenic patients with lower urinary tract dysfunction and answer the question if SNM can be expanded in our treatment armamentarium for this patient group. We've performed a systematic literature research. According to the PRISMA statement, the inclusion criteria was that at least 4 patients were published in each publication. For a second run, we did the same analysis with 10 or more patients. Out of the 1,500 publications, we have found 47 were evaluated to fit our situation. For the testing, we were able to demonstrate that in average 66.2% of the patient had a success rate with a range from 57 to 75%. The indications have been from incomplete to MS and back surgery, whereas complete spinal cord injury has no success if the time frame from the injury to the implantation was too long. Only with an early implantation, the success rate could be reached to 80%. However, out of those patients who underwent a successful testing, a permanent implant was performed in 84%, with a range from 78 to almost 90% in the publications in 428 patients. The adverse events which were mentioned were almost comparable to those in idiopathic publications, like infection, pain at implant, lead migration, and hardware issues. In addition, the loss of effectiveness seen with 4.7% is probably also depending on the progression of the neurogenic disease. There are limitations and definitely risk of bias related to the selection of patients. There's missing data and the measurement of the outcome, how it was published in those reviews. And of course, it is a bias what has been selected. But the major point we think is the heterogeneity of the patient population we evaluated with a neurogenic disease as a base point. In conclusion, this is the largest meta-analysis, but it supports the benefit of chronic implant of SNM. The success rate of this implantation is almost comparable to those of the idiopathic group. It reflects the benefit of the real-world data in this very difficult to treat heterogeneous neurogenic group. The new devices, which are MRI compatible, it can become a therapeutic option for the various pelvic floor dysfunctions and possibly to treat them even simultaneously. However, we need prospective studies to verify for those subpopulations SMS this outcome, as we have seen with the review we have performed and the meta-analysis.